Inayat Singh Kakar is one of them. She's part of a citizens volunteer group helping families affected by COVID-19. She joins us now live on Skype from New Delhi. Many thanks for speaking to us on Al Jazeera and taking the time. You must have so much to do. In fact, give us an idea of your day. How have you been helping people in this crisis?
Right. Thank you so much for having me. Like you said, there are many volunteer groups that have come across that are responding to requests from patients, that are coming in through their networks, through social media, and primarily what exists is an information gap where people do not, despite the government setting up information portals to keep people updated with real-time information on bed availability. These portals have not really been functioning. Nodal officers have not been responsive in many hospitals, and there's very little coordination between hospitals themselves, and there's a complete breakdown of referral services. And that is the information gap that many volunteer groups have been filling, where we're getting requests from patients for oxygen, for accessing ambulance services, for finding out about availability of hospital beds, and that is that is the service that volunteer groups are providing in verifying information that comes in verifying where oxygen is available, connecting patients to these resources and these services, and using whatever personal connections people have, whether that is doctors in specific hospitals or somebody within the system who can help patients access healthcare. But that is Yes.
And what is it that you're seeing? What are the main challenges you are facing? Is it the lack of beds? Is it the lack of oxygen? Is it the lack of hospitals? What are the main challenges?
The main challenges we're facing are, number one, with regards to testing. So people are not able to access testing. It takes 3 to 4 days to be able to book a test, and then further 3 to 4 days for people to get the test results. Then there is the challenge of, accessing a doctor who can, tell you whether you need to go to hospital or whether you can be managed at home. We're facing challenges in getting, people are facing challenges in accessing doctors who can provide home care if that is required. Then, of course, ambulances to reach hospitals, find out where hospital beds are available. There are severe shortages of ICU beds, ventilator beds, and oxygen cylinders and oxygenators. And then even when people do get admitted to hospitals, there are issues where people are not getting, particularly great quality of care because healthcare workers are also overburdened. So yes, these are broadly the issues that people are grappling with.
How dire is the situation in India? Because some of the images that we're seeing of people just waiting outside of hospitals, in beds, people dying, waiting for a bed to come through, some horrifying images. What is your experience?
I would say the situation is pretty dire, and I think the fact that Twitter has become the national COVID helpline is telling. And it's not just individuals, volunteers, and patients and family members who are reaching out to Twitter for help, but now we're seeing even large private and corporate hospitals taking to Twitter to highlight the fact that they do not have oxygen to service patients. So the situation is extremely dire, and one aspect of it that we're seeing on television is what's happening in hospitals, but there is a whole number of cases of people who are not able to access hospitals. They are still at home. They are not getting the kind of home care and follow-up that they require. And what is happening is that they're not able to access oxygen to even keep them, to keep patients stable. And so what's happening is that patients are, by the time they reach the hospitals, their situation is extremely dire, extremely severe. And many of these deaths, would be avoidable if care could reach them and oxygen could reach them and COVID therapies could reach them at their home.
You were volunteering last year when COVID first broke out in India. How would you compare the situation then with the situation now?
Right. So I would say that the situation is a lot more desperate this year. Last year, when we were getting, calls for help, it was mostly it was mostly like one person or two people in a household who were infected. But this year we're seeing entire households being affected by COVID. Last year there was not such a high requirement for oxygen, and I speak from my experience in Delhi. Last year, at least in Delhi, there was some level of home care and follow-up visits that were being done by the government. to make sure that, people who are in home isolation don't get to the extremely critical stage before they have to be rushed to the hospital. This year, we really have not seen, we have not seen this kind of home care being provided to patients. We are not hearing of contact tracing taking place to ascertain, who all the patient has been in touch with, and then to sort of contain the virus in that sense.
And one more question for you. Presumably you can't help everybody that turns to you. That must be very difficult, what you've been seeing day to day. What kind of emotional impact is this having on you?
I mean, to be honest, I have been taking a mental health day today and yesterday because it is extremely distressing, when you're speaking to patients and most times we end up providing a lot of emotional support to families, and just having to tell people that, okay, no beds are available, but we're doing what we can. I think that takes a toll on you. Many volunteers have also had patients they've been helping die. People have died right when they've reached the hospital, right after getting admitted or in waiting areas of hospitals, and that is taking a huge mental health toll on people. Psychosocial care is not something that the country has ever really emphasized on, and we're seeing, volunteers being left with absolutely no support. And we're having to reach out to each other, provide that kind of support to each other. There are friends who are reaching out, checking up, how are you doing? Are you taking a break? So it is extremely distressing, to be so severely limited and not do everything that you can for people. But despite that, I would say there's a remarkable effort by individuals, volunteers on the internet, coming together, people who don't even know each other, people who haven't met, coming together to help out cases. And I would say, big hats off to our healthcare workers who have been so stressed in the past 1 year. And despite that, when we need to provide teleconsultations to people or counseling from doctors, there are doctors who, healthcare workers actually, not just doctors, but healthcare workers who are doing hospital duty, but at the same time, during their off hours, they are stepping up to provide teleconsultation and telecounseling services to patients. And I think that is amazingly remarkable, because I do not know the kind of pressure and emotional, trauma they must be facing from working in under-resourced and underfunded systems.
Yeah, I'm sure. Inayat, so much thanks for speaking to us on Al Jazeera and taking the time to tell us your story. Inayat Singh Kakar, one of the citizen volunteers in Delhi.